Good evening, everyone. Can you listen to me?
Good evening. Yes, Encinas.
Yes, good evening.
Okay, and can you watch my screen?
Yes, we can.
Perfect. Thank you. Mm. Okay. Let's continue then. We're gonna talk about mental illness today. Okay. For this, I'm gonna ask Carla Barta, please, to read the first part.
Good evening, Miss.
Good evening.
Mental illness. Psychiatric disorders. Psychiatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest form of the dementia is that associated with old age, senile dementia. Disorders in which there is no obvious pathology or anatomical change in an organ are termed functional. Do I continue, Miss?
Yes, please.
Okay. Substance abuse. Abuse of substance means using it in a way that harmful. The common forms of substance abuse are alcoholism and drug abuse. Neurotic and stress-related disorders. An example of neurotic disorder is obsessive compulsive disorder, and obsession is an idea that is so persistent that it interferes with the patient's life. A compulsion is an obsessive idea that forces the patient to act even though they recognize that it is unnecessary. A common form of this compulsive washing of the hands expresses a feeling of being unable to cope. It can lead to an anxiety or fear of problems. A sudden attack of anxiety is called a panic attack.
Okay, thank you so much. Pediatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest form of dementia is that associated with old age, senile dementia. Disorders in which there is no obvious pathology or anatomical change in an organ are termed functional. Substance abuse is another mental illness. Abuse of substance means using it in a way that's harmful. The commonest forms of substance abuse are alcoholism and drug abuse, neurotic and stress-related disorders. An example of neurotic disorders is obsessive-compulsive disorder. An obsession is an idea that is so persistent that it interferes with a patient's life. A compulsion, an obsessive idea that forces the patient to act even though they recognize that it is unnecessary. A common form of this is compulsive washing of the hands. Stress is a feeling of being unable to cope. It can lead to anxiety or fear of problems. A sudden attack of anxiety is called a panic attack. Okay, so do you understand the word tended in this part? Okay, I'm sorry. Is another way to say we that we called by that name. Do you understand? Hello?
Mm,
Okay. Do you have any other question?
sorry, I think I didn't got what term exactly means. Is it like saying,
It's like saying, for example, no obvious pathology or anatomical change in an organ are called functional.
oh, okay, then yes, it is what I was thinking. Thank you,
Yeah,
Miss.
no problem. Okay, so do you have any experience with this kind of mental illness or another during your studies or maybe on your consultation?
Mm, I think that senile dementia is like one, like it says, is one of the most common forms of dementia, and you can see it almost every day, everywhere, with elderly people. So yeah.
Okay, thank you, Sergio. Anyone else?
Good night, teacher. Good night, everyone. Yeah, in anesthesias, most of the common that so many colleagues have abuse of fentanyl, for example.
Mhm.
I I meet one colleague that two colleagues that died the last year,
Wow.
and I know one colleague that is dealing with the disease since maybe 6 years ago.
You said fentanyl?
Fentanyl, yeah.
Okay, could you explain to us what we use that for?
Fentanyl is an opioid that it's very common to use in the anesthesia
Mhm.
to relieve the pain of the surgical incisions.
Okay,
And it brings a very blissful feeling, and I think that's the reason so many so many colleagues
use it.
uh, had that the substance abuse with fentanyl.
Oh, that's so sad. Thank you, Claudia. For people.
Thank you.
Thank you, Claudia. Anyone
Okay,
else? What about anxiety? It should be like a mental illness.
Maybe it's considered a neurotic, like it says, a neurotic or stress-related disorder, right?
Mhm. But it's not like a mental illness um, as a whole, right?
Yes, exactly.
Okay. Okay, thank you, Sergio. Um, I don't know. Jorge, are you here? Can you read this part, please?
Sure, okay. Affective disorders, an extract from a medical textbook. Affect and mood are similar in meaning and refer to the emotions. For example, happiness or sadness. Affect tends to be used for temporary emotions, and it is expressed through manner of speaking, facial expression, or behavior. Mood is used to refer to a more permanent emotional state. The most common form of affective disorder is depression, the symptoms of which are poor appetite or significant weight loss, sleep disturbance, for example, insomnia, inability to sleep, fatigue, loss of energy, psychomotor agitation, excessive movement and thought, or psychomotor retardation, slowing of movement and thought, loss of interest in stimulating activities, decreased ability to think and concentrate, feeling that one is of no value to others or that one has done something wrong, recurrent thoughts of death or suicide. Five or possibly four of the above symptoms occurring nearly every day for at least 2 weeks constitute a major depression.
Thank you, Jorge. Well, do you have any questions for vocabulary here? Have you ever been depressed? Hello?
Yeah, many times. I think we all been
No?
depressed at some times of at some point of our lives.
Okay, but you knew it? Or maybe you went to a psychologist or something like that?
Oh, yes, I was aware of it, and I also talked about it. I mean, sometimes it was with my family that I
Mhm.
shared my stories, or sometimes with friends or some close people.
Okay, okay. Thank you, Sergio. Claudia, do you want to say something?
Um, I think the anxiety and depression are very common in 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 the hospitals. I think with doctors, for the burnout syndrome. I think so. The excess of work, and I think that most of the doctors underestimate the symptoms, and most of them don't have a good treatment for these diseases. That's why one of the reasons, for example, in anesthesia, they uh, like the like we have a very easy access to that kind of drugs. They recur to that drugs to have a pain relief.
Mhm. Or that kind of pain. It's not a physical pain. It's like they
Physical,
are
physical and mental, both,
okay.
both,
Okay.
both. And most of the doctors that died for this drug that I commented before, most of them are with troubles or with depression or burnout syndrome. So it's very common.
Okay, Claudia, thank you. I
Thank you.
agree with you guys. Since it's like a silent disorder or this mental illness, it can be a little bit dangerous, right? Maybe Sergio recognize it and talk to people, but other people doesn't have the chance to do that. So we have to be careful in this area of our lives. Okay. Any question here? Nothing? Let's continue then. Mateo, could you read this, please?
Okay. Neurotic and stress-related disorders. This includes behavior syndromes associated with physiological disturbance, such as eating, disorders of adult personality and behavior, for example, personality disorders, mental retardation, delayed mental development, and schizophrenia and other disorders in which there are delusions or false beliefs.
Thank you. Okay, those are examples. I don't know if you have another kind of example that we can include here. Nobody? Do you think those are the most common ones? Okay, Rina, are you here?
Yes, teacher.
Okay, Rina, I miss you. Do you think there are another kind of examples to add here?
Probably some examples of disease inside in these categories. For example, and the disorder of adult personality and behavior. There are, I think, because I am not good at that classification, but I remember the psychosis, for example. The another one is the psychosis for the abuse of substance abuse of substance, and there is another one in the for example, schizophrenia. There is the schizophrenia caused for abuses of the different substance drugs, specifically, for example, cocaine, heroin, and another kinds of substance provokes the causes that kind of disorders.
Okay, Rina, thank you. Anyone else wants to say something? Nobody? Any question for vocabulary here? Jocelyn Weimar. Okay, I think it's pretty clear then. Okay, Alejandra Macias, can you read this part, please?
Yes, teacher. Which symptoms or depression was this patient suffering from? Look at C opposite to help you. Case 41, a 56 years old woman present to her GP complaining in the past few months. She was lost in are
Ale, I'm so sorry. Guys, could you listen well? Or I'm the only one?
I cannot hear also.
Okay. Sorry, Ale, but thank you so much. I think your internet is a little bit unstable. I will repeat again. Case 41. A 56-year-old woman presented to her GP or general practitioner complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. Do you have any questions for vocabulary here? Do you understand the word tended to wake up early, for example? Tended. No.
Teacher, what is the meaning of steady?
Steady. Where is it? Oh, it's like stable.
Ah, okay. Thank you.
Okay. Any other question here? Nothing? Can we continue then? Um, please, Claudia, can you help me here?
Okay. The nervous system 1. Sensory loss. The central nervous system controls the sensory and motor functions of the body. Disease of the system, therefore, lead to loss of some of these functions. Function. Hearing loss, deafness. Other symptoms, buzzing or ringing in the ear. Tinnitus or tinnitus, I don't know.
Tinnitus.
Tinnitus, okay. Sight, blindness, double vision diplopia, blurring, loss of visual acuity, clarity of vision. Sensation, feeling, numbness, anesthesia, tangling or pins and needles, paresthesia. Balance, unsteadiness, ataxia, dizziness, vertigo. No,
Thank you.
there are no common words for loss of or conditions relating to taste and smell.
Thank you, Claudia. Okay, just remember function. Okay. For hearing would be the loss of or unable to hear will be deafness. Other symptoms, buzzing or ringing in the ear. That will be called tinnitus. Sight is the other function. The loss, blindness. Other symptoms, double vision, diplopia, blurring, loss of visual acuity or clarity of vision. sensation or feeling. The loss would be numbness or anesthesia. Other symptoms, tingling or pins and needles. That would be called also paresthesia. Another function would be balance, loss, unsteadiness or ataxia. Okay, other symptoms will be dizziness or vertigo. Do you understand every word? Is there any question here?
Miss, excuse me. What does
Yeah.
tingling means?
Tingling,
Yes.
it's like when you are, when you feel like a sensation of, how can I say? In Spanish, I will tell you, okay? Como pinchazos, hormigueo.
Ah, okay. Thank you.
No worries. Okay, another word. Okay, let's continue. Here, Jethro, would you help me here, please?
Okay, teacher, good evening. Motor loss, weakness, loss of power, paralysis, completely loss of power, tremor, involuntary rhythmic movement, especially of the hands, abnormal gait, unusual manner of walking. Speech may also be affected, for example, with your hoarseness, aroused, deep voice, having vocal cord paralysis. Slurred means poor articulation, having cerebral disease.
Thank you. Okay. As you can see, weakness is loss of power. Paralysis, complete loss of power. Tremor, it means an involuntary rhythmic movement, especially of the hands. Abnormal gait would be unusual manner of walking. Speech may also be affected, for example, with hoarseness, a rough, deep voice, and as in vocal cord paralysis. Slurred means poor articulation, as in cerebral disease. Okay, do you understand this word hoarseness?
No, teacher.
Okay, is there anyone that can explain to us? Nobody?
Yes, I could help with that.
Okay.
It's like the voice. For example, when you got, I don't know, the flu, when you got a cold, like I do, you feel like your voice is very deep, like Darth Vader, like, oh, wow, very deep.
Yeah. Okay, thank you. Thank you, Jorge. Do you understand the word now?
Yes, teacher.
Okay, Jed. Are you sure? Can you tell me in Spanish what it means?
I really, como sería como una voz más gruesa, ¿no? Gruesa, como cuando estás resfriado.
Sí, ronco, ronquera.
Exacto.
Okay, good. Perfect. Any other word? Okay, I think it's clear then. Jocelyn, can you read this part, please?
Okay, teacher. A loss of con conclusions.
Yes.
A patient might describe sudden loss of con consciousness in number of ways. I passed or had a blood of patent. I had a pain seizure, a convulsion, pit seizure and convulsion are all used to refer to violent involuntary moments as in epilepsy. The doctors may say, when did you lose conscience,
Consciousness.
consciousness?
Okay, thank you. Loss of consciousness. Patients may describe sudden loss of consciousness in a number of ways. I passed out. I had a blackout. I fainted. I had a fit, seizure, or convulsion. Fit, seizure, and convulsion are all used to refer to violent, involuntary movements as in epilepsy. Okay? Doctors may say, when did you lose consciousness? Okay. Do you have any experience with this kind of patients?
Yes, teacher. I have some situations, sorry, about the loss of consciousness. For example, I had a child around 9 years old that his parents comes to the clinic and they say that child has had a fever during the night, and when they decided to come to the clinic, the child starts to present convulsion and the patient pass out. The child didn't remember anything. Yes, it's a child around 9 years old, but in that moment, the child pass out. Yeah, that is one of the situations. Another one, I had another patient, a teenager, in fact, but he had he was diagnosed 5 or 6 years ago, about he had a diagnostic, I'm sorry, the epilepsy. He had epilepsy, and yes, in that moment he didn't tomarse las píldoras o tomarse las drogas, teacher, drink or swallow the pills.
Okay.
Okay, swallows the medication and he start in the moment a convulsion. The kind of convulsion where he pass out too, and with the convulsion has a seizure. Yeah, well, it's the same, teacher. Fit, seizure, and convulsion are the same.
Yes.
Okay. Yeah. And had another one but that kind of loss of consciousness it was because the patient had another disease, for example, diabetes, una descompensación for diabetes or renal disease, for example. Yes.
Yes. How was the problem with the patient? With diabetes, you said?
Yes. That kind of patient, well, the patient has this diabetes type 2, especially has many symptoms without the problem with the glucose in the blood. For example, that patient with the medication has a problem about the electrolyte, el equilibrio de electrolitos, sodium, potassium, and when that patient has deficiency of potassium, for example, has the patient has the probability to suffer a loss of consciousness. The another kind of problem is about the descompensation of the control of the glucose, specifically study hyperosmolar. It's a kind of coma about the high of the glucose in the blood. And another one is the cetoacidosis diabética. In that moment, the patient had a blackout, yeah?
Yeah.
That is one of the causes in the patient with diabetes.
Okay, an unbalanced situation with diabetes then. Do you listen?
I'm sorry, teacher, I cannot hear you well.
Okay, now can you listen to me?
Yeah.
Okay, I will write it on the chat, okay?
Yep.
Unbalanced. Can you listen to me well?
Yes, teacher.
Okay.
Unbalanced, do you refer desequilibrio, right?
Yes.
It doesn't, desequilibrio electrolítico, it's a electrolytic unbalanced.
Electrolytic unbalanced.
Okay.
Okay, thank you, Rina. I don't know, Claudia, do you want to say something?
Yeah, I have patients with loss of consciousness, with seizures, especially at the intensive care unit. And maybe also pregnant women that present seizures also. With a common disease that is named preeclampsia, and it presents eclampsia before of the cesarean. And you have to act very quickly with those patients. It's very dramatic for the people who's not to come on to see.
Yes. Okay,
Yeah.
Claudia, thank you.
Okay.
You make me remember when I was on my first year, I wasn't so into make a surgeries, okay? So I had a problem like that on my first surgery. I
Good,
there,
and
well, doctors didn't know if help the patient or me. Yes, I passed out on the place.
really? Oh, poor teacher.
That's why I don't like surgeries. But
Oh, yeah, it's
it
not for
happens.
everybody.
Yeah. Okay, thank you. Let's continue then. Sergio, could you read this part, please?
Yes, sure. Here is a passage from a textbook on the causes of loss of consciousness. The principal differential diagnosis is between an epileptic fit and a syncopal attack or fainting. Syncope is a sudden loss of consciousness due to temporary failure of the cerebral circulation. Syncope is distinguished from a seizure principally by the circumstances in which the event occurs. For example, syncope usually occurs whilst standing under situations of severe stress or in association with an arrhythmia. Sometimes a convulsion and a urinary incontinence or loss of control of the bladder occur even in a syncopal attack. Thus, neither of these is specific for an epileptic attack. The key is to establish the presence or absence of prodromal symptoms or symptoms that occur immediately before the attack. Syncopal episodes are usually preceded by symptoms of dizziness and lightheadedness. In epilepsy, people may get a warning, known as an aura, that an attack is going to happen. Note, the noun convulsion is often used in plural form. He had convulsions as a child.
Okay, thank you so much. Sergio, do you have any questions here for vocabulary?
Yeah, teacher, fainting.
Painting? It's
Yeah.
like when you pass out, like you end on the floor, losing
Ah,
consciousness.
oh, okay, thank you.
Okay, maybe this word whilst standing is the same as do you understand?
No.
I'm writing on the chat, but whilst is the same as while, okay? And it means mientras que. Whilst. Do you understand now? Do you understand now?
Yes.
Okay, thank you. Is there any other question here? Okay. Can we continue?
Yes.
Thank you. Melanie, can you read this part, please?
Yes, Miss. The nervous system 2, the motor system. Examination of the motor system should include assessment of the following. Muscle bone, amount of muscle tissue, or look for sign or wasting muscular atrophy. Muscle tone, amount of tension in a muscle when it's relaxed. Tone can be increased, spasticity. How can I say this word? Spasticity?
Plasticity.
Okay, spasticity or decreased flaccidity, muscle power strength, coordination, the ability to use several muscles at the same time to perform complex action, gait, the manner of walking, reflexes, CB below, involuntary movements, for example, a tic or a tremor. Here is an extract from a case report about a patient with a tremor. Case 80. On examination, her face showed little or no expression. There was a tremor affecting mainly her right hand. She had general increased muscle tone, power, reflexes, coordination, and sensation were within normal limits. Examination of her gait showed that she was slow to start walking and had difficulty stopping and turning.
Okay, thank you so much. Well, we have here muscle bulk. Okay, that is an amount of muscle tissue. Look for signs of wasting, muscle atrophy, muscle tone. That is an amount of tension in a muscle when it is relaxed. Tone can be increased, that is called spasticity, or decreased flaccidity. Muscle power is strength. Okay, coordination, the ability to use several muscles at the same time to perform complex actions. Gait, the manner of walking. Reflexes. Okay, we will find here involuntary movements, for example, a tic or a tremor. Remember what was the meaning of tremor? Do you remember?
A
The-
constant and rhythmic movement, involuntary movement.
Involuntary movements, yes.
Yes.
Okay,
But
thank you.
Exactly.
Do you have any questions here? Nothing? In this case, what is the meaning of muscle bulk? Of course, an amount of muscle tissue. But in Spanish,
Masa muscular.
yes.
Posible masa muscular, teacher.
Yes.
Yeah.
Thank you. Thank you, guys. Okay. Let's continue. Can help me here. Weimar, could you help me here?
Yes, teacher.
Okay, go ahead.
Tendons reflexes examination of the nervous system normally includes testing the tendon reflexes. For example, the knee jerks weight tendon hammer, also known as a reflex hammer. The reflex The reflexes may be absent, diminish, normal, or brief. The blinker reflexes are also checked. The normal blinker response is ongoing moment, plantar flexion of the big toe and outgoing extensor or Babinski response is abnormal.
Okay, thank you. So we have tendon reflexes. Examination of the nervous system normally includes testing the tendon reflexes. For example, the knee jerks with a tendon hammer, also known as a reflex hammer. The reflexes may be absent, diminished, normal, or brisk. The plantar reflexes are also checked. The normal plantar response is a downgoing movement that is called plantar reflection of the big toe. An upgoing toe is called an extensor of Babinski response and is abnormal. Do you know the Babinski response? Or the Babinski sign, maybe?
Yeah, it's the extension of the fingers of the foot when you stimulate at the, I don't know how to say, in the foot.
In the toe?
I don't know.
Okay, try to explain it again. I know you can.
Okay, it's the flexion of the fingers of the feet when you stimulate the posterior part of the feet. I don't know how to say.
Okay, what do you want to say?
Planta del pie.
Plantar toe, yeah.
Plantar toe, yeah. And it's normal at the newborns, but abnormal on the adult people.
Okay. Okay, thank you, Claudia. Anyone else wants to explain? The Babinski sign?
Oh, yes. It's a stimulation of the lateral plantar aspect of the foot. And as our classmate said, is normal in children, but in adults, it says that the corticospinal tract is damaged.
Okay, so it's really abnormal on adult people, right? Jorge?
Oh, yes, sorry. Yes, it's a normal in adult people.
Okay, thank you. Thank you so much. Okay. Do you have any questions here for vocabulary, maybe? Nothing? Okay, guys. I think we finished here, or we're gonna stop here. And I will send to you my 2 questionnaires, okay? Please, I don't know if you can see it, let me know. So we are,
Yes, I can.
okay. You are 12, so I need 12 answers, please. If you cannot answer, please let me know so I can send you to you at the group, okay? Okay, 9, 3 more, please. 10, 2 more.
Excuse me, Miss.
Yes?
Could you repeat the schedule of today's practice, please?
Yes, of course, I will do it.
Thank you.
Give me a second. 2 more, guys. I don't know who is missing the questionnaire. Okay, today it's gonna be 9 Jethro, 9:15 Carla Calle, 9:30 Jorge, 9:45 Rina, 10 Alejandra, 10:15 Claudia, and 10:30 Carla Bar.
Teacher, the last class you said that I was at the first at 9 p.m.
Melanie?
No, Claudia.
Claudia.
Yeah, you
Yeah,
asked, you said the order and I choose 9 p.m.
yeah, I'm so sorry. That's right. Claudia,
Teacher,
9.
I changed the schedule too.
Yes, that's right. Carla, Claudia, 9. Jethro, 9:15. Jorge, 9:30. Rina, 9:45. Alejandra, 10. And Carla Calle, 10:15. And Carla Barta, 10:30.
Oh,
Okay?
Mrs. Sorry, I'm missing.
Sergio, you are for Wednesday, so no worries.
Oh, Wednesday. Sorry.
Yes, no problem. I
Thank you.
will let you know the schedule for Wednesday, okay?
Perfect. Thank you.
This is today, just for today. Okay. Wait, please, don't go. I have one more questionnaire, and then you are free. Okay. Okay. Can you see my questionnaire?
Yes.
Okay, thank you. 5, 6. Eight. Okay, we almost done. 2 more. Please. Uh-oh. Okay, one more. And I'll let you go. Okay. Thank you so much for your time, guys. See you tomorrow, okay, on our practical class. Okay, thank you so much. You can go now. Take care.
Bye, everyone. Thank you.
Thank
Bye-bye.
you. Bye.
Thank you, teacher.
Goodbye.
Bye.
Goodbye.
Take care. Bye-bye. Claudia, you stay with me.
Yeah, I'm here, teacher.
Oh. Okay, Clau.
I was to
Eh,
defend.
Did you have the chance to watch the slides I sent to you this afternoon?
Yeah, teacher. I have seen it.
Okay. Okay, Claudia. So maybe, I don't know, you can think of a patient that may have diabetes and
Okay.
think of 5 questions you can ask the patient to investigate further about his or her condition.
Okay.
Mhm.
I will ask, how is
Please.
your, okay,
Thank you.
okay. How is your general health? Do you feel very tired after you have lunch or have breakfast, for example? Do you have any problem with your vision, or do you feel some paresthesia in your fingers or your toes or your feet? Also, do you urinate a lot on the day, or do you have polyuria? That will be the term.
They don't know those terms, right?
That's those words, those terms, yeah. Do you have or feel so much hungry on the day? Do you feel thirsty?
Yes.
At morning or at night? I think that's the most important in a diabetic patient.
Okay. And I don't know, but do you ask if they have any injuries or something like that?
Yeah, if they have some paresthesia or tangleness. I think we learned that term today. Yeah, it's tangling, no?
Okay.
Tangling. Or Miguel?
Twingling.
Yeah. You feel tingling your fingers of your hands, of your foot.
Okay.
Find some position. Yeah.
Okay, perfect. Many patients do not know the function or location of the spleen and pancreas. For example, how would you explain them to the patient?
The function of the pancreas?
Where they are.
Okay.
Yes. The function and the location.
Okay. Yeah, the pancreas is located at the below your stomach and back to your stomach, maybe. And it's most closest to your spine, not so external, but it's in your epigastrium, but they don't understand epigastrium, so it's behind your stomach and more close to your spine on that side. Your spleen, how do you say?
Yeah, spleen. Do
Spleen.
you remember?
Yeah. Your spleen is located on the left side of your stomach, and it's below your ribs on the left side, up of your kidneys and your I don't remember how to say intestino grueso or colon.
Colon, you can say, or a large bowel.
Of your large bowel or your left angle, colonic angle, I think. Exactly.
Okay. But remember, the patient doesn't know where is
the terms. Yeah.
Okay. On easy terms. Okay. And what is the function of those organs?
Okay, the principal function of pancreas is to produce insulin, that it's a hormone to helps to have an adequate metabolism of the sugar or your blood sugar. And the sugar levels on your system will not be as high as to be toxic in your body. That's the principal function of the pancreas. For the spleen, the principal function of the spleen, it's to produce some immunity cells to help you with your immunity system.
Okay, perfect. And I want you now to choose another disease, and I want you to make some questions to get a diagnosis.
Okay, I choose that some disease.
Yes, you choose the disease.
I don't know which this is.
Or maybe hypertension, or we talk about diabetes, and no. Here, another one. Those are
chronic renal failure.
okay. Okay.
Or acute renal failure. Okay, acute renal failure, it's a reversible condition that if it's treated at the first 72 hours. The most common reason of the renal acute failure is the hypovolemic shock or with the acute blood loss. It has a classification where that is guided for the glomerular filtrate, and we take the parameter of the creatinine that it's higher of 1.4 milligrams per deciliters. So it's very dangerous because it can convertir or
convert
it can convert a chronic renal failure,
or it can turn on.
It can turn on
turn into
okay. It can turn into a chronic renal failure. The basic treatment is so many liquids to make the glomerulus get a function, and diuretics at the beginning of the treatment, also like furosemide or Lasix, I think.
Okay, that's so good. That's a great explanation. But I want to know, how would you ask to your patient? What kind of questions do you you can ask to your patient to investigate further about this disease?
Okay, if you are you have been going to the bathroom to urinate? How many times did you urinate on the day, or after if you're in the hospital? So if you feel thirsty, no. And do you have some toxic symptoms for the elevation of the creatine, for example? Like if you feel so tired, or you have dizziness, and if you have the some reason that you lost a lot of blood, some condition that makes you lose a lot of blood.
Okay. Another question. It would be cystitis is one of
Infection
the
of the blood.
one of the symptoms of this disease or no?
No. No. A cystitis is an infection for a bacteria, and it's located at the bladder specifically. That infection can migrate for the ureters and also to the
Urethra?
kidney.
Okay.
To the yes, first for the ureters and after to the kidneys, and that's can form to renal abscesses or kidney abscesses that it's very, very dangerous, can derive to a chronic renal failure.
Okay, it can be the beginning of this condition.
Yeah, that's the reason and the importance to treat that to give a good treatment, and that it could be focalized on the specific bacteria that it's giving that infection.
Okay. Okay, thank you, Claudia. While I send you again our questionnaire from this practical class, I will make you the last question. Is there any kind of pain that feel the patients that can tell you that they have this failure?
Yeah, the lumbar pain.
Mm-hmm.
The lumbar pain is the most of the common. With cystitis in specific, you feel dysuria, that is the pain when you urinate.
Okay. And what kind of differential diagnose can you make with another disease?
Well, cystitis in specific, it could be confused with a normal lumbar pain, but it could be for the distension of the muscles or some. I think is the most common reason that it's the differential diagnosis.
Okay.
Also, gastroenteritis it's a
gastroenteritis.
Yeah, gastroenteritis for the fever and the pain.
Okay, so how could you make this difference?
The diagnosis, you give it with an ego, that is a general examination of the urinate, and you can see the leukocytes that are on the highest level. Also, the fever is not sequential day after day. The pain of when you urinate is another thing to think in a cystitis, and that's the principal reason.
Okay, Claudia, thank you so much.
Teacher, I couldn't send the practice of Friday. I was working so crazy on Thursday and Friday.
Oh no. Okay, no worries. Send it to me.
Please,
but
please.
I don't know, today or tomorrow?
I think I can do it for tomorrow. Until what time?
Until afternoon, I don't know, 2 p.m. maybe.
2 p.m. Okay,
Yes.
I will send it before 2 p.m. Maybe tonight, I don't know, in the morning.
Okay, yes, please. Because I will make the scores. I will put the scores on the file, and I will send to you another questionnaires. Okay, another practices. So it would be better if you send it before. Okay.
Okay, thank you, teacher.
No problem. Take
Yes,
care.
thank you.
Have a great
You
night.
too,
Bye,
teacher.
Claudia.
Bye.
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 Hi, Jethro.
Hi, teacher. Good evening.
Good evening. How are you?
I'm fine. Thanks, teacher.
Okay, that's great. Okay, did you have the chance to watch the slides I sent to you this afternoon?
Yes, teacher. Yes, I can tell.
Okay, remember that we were talking about how to explain signs and symptoms to the patients. So I want you to think about a patient who has diabetes, okay? And think of 5 questions that you can ask to your patient to investigate further. Maybe you can try to use the question types that we presented on the slides. Or maybe you can use yours, but 5 questions that you can ask to your patient to investigate further, okay?
Okay. Mm,
Okay.
Doesn't have diabetes. In a patient who I suspected diabetes, right?
Yes. Yes, you have a patient and you think that he has diabetes, he or she has diabetes. So what kind of questions do you ask to investigate further
Maybe
to stay sure?
how often you do exercise, maybe?
Okay.
I think the more important questions I can do with my patient is what is your symptoms that you have right now? Example, with the diabetes have symptoms, no sé cómo, la palabra, síntomas característicos.
Okay, characteristic symptoms.
Exactly, characteristic symptoms. It's like 4 P's. It's, I don't know how to say in English, but it's polifagia, poliuria, polydipsia, pérdida de peso injustificado. Maybe,
Polyphagia, polyuria, polydipsia, and what is the other one?
loss of weight, right?
Loss of weight. Okay.
Maybe I think maybe you have one of these conditions or one of these symptoms. Maybe I can ask her. I can ask the patient.
But you have to ask the patient. If you tell her that maybe do you have polyuria or dipsia, they won't understand you, right?
I get it.
Okay.
Maybe,
I'm your patient. Ask.
maybe in the last of weeks of months you have how often you go to the bathroom in the day? Maybe this is one of the questions to justify the polyuria, right? Maybe another one question I can do is I don't know. Oh no, oh. Are you feel hungry all the day? I don't know how to say this word.
How hungry?
Sí, o sea, como cuántas
Okay.
veces ganas de comer.
How many times do you eat at the day? In one day? Or maybe you can ask, do you eat often? If you want to ask that. Is that correct?
I can listen to you, teacher. Can you repeat, please?
Sorry. Yes. You can ask how often did you eat?
Exactly.
How often or how many times per day you eat, right? To know that.
Yes, and I remember now. I think one of these important question in this disease is your parents or your brothers, your dad or your mom or your uncles have diabetes too. I think this is the more important because in this disease it's hereditary, right? And it's diabetes type 2 specifically.
Okay. What else?
Um, um, are you feel what's sediento? I can't remember that word.
Thirsty.
Thirsty. Do you feel thirsty all the day, all the time? Maybe.
Okay.
Maybe I think this is important too. Do you drink Coca-Cola or I don't know. This is the
Okay.
most.
Do you ask, for example, do you have any injuries that maybe may not heal or no?
Can you repeat this, teacher? I can hear you.
Yes. If the patient has any injuries that may not heal.
Like another pathologies, maybe, or what, teacher? I don't
No,
understand.
no, like some injuries, for example, on their foot. I don't, if I'm not wrong, yeah. If the patient has some injuries, maybe, or it's in an advanced stage.
Exactly, it's in an advanced stage, like in kidneys injury and then the injuries in the foot. Like I don't know how to but be diabetic, no? It's an advanced in this disease, not in agudo, no? This tool or
Acute. Okay.
it's not.
Okay. Okay, Jethro, that was good. Well, many patients do not know the function and location of the spleen and pancreas. How would you explain to them where are the location and the function of the spleen and pancreas? Do you remember what is the spleen?
No, I don't understand.
El vaso. Spleen.
Okay, I don't understand. You talking about pancreas and now
Yes,
this.
pancreas and spleen, both.
Okay, well, how can I explain my question? What is and where is the location? And
Yes, where is the location and what is the function of those organs?
okay, I can remember the word exactly word in English, but there's a órgano del sistema inmune.
Okay.
Okay.
Immune system organ.
Immune system organ. Okay. Thank you, teacher. I can explain my patient. This. Okay. First, the pancreas. The pancreas is an organ who is in the I don't know how it's abdomen. It's the same word in English, right?
Abdomen, yeah. Just the
Abdomen.
pronunciation changes.
Okay. And then in your abdomen, maybe, and this one is very important for your body, because it can produce insulin, and this one is very important for control with sugar. I can't say sugar, right? Sugar in your blood, for my patient to understand. And this is not the only one, but this one is the more important function of this organ, with the control of sugar in your blood. I can say this for my patient.
Yes.
And the second, I will explain, is the same. It's organ there is a location on your abdomen, maybe in the left side of your abdomen, left and superior. Superior.
Superior?
See, yes, superior. The left side and the superior of your abdomen. With this one is very important for, I can't remember, for se me fue la palabra.
They
For-
control?
Exactly, the controles, for control, maybe I can say control the red bloods in your body. Es like recicladora, no sé, esa es la palabra que se usa como reciclar, reciclar.
Okay, continue. I will find out.
Okay, maybe control the red bloods in your body. And the one is, I think, is the more common organ who have suffered damage in the accidents of
Recycle. We both forgot about that.
okay, teacher. Entonces, can say recycle the red blood cells in your body, right? And this one is very important because the red blood cells helps to have a good circulation and that's all I think.
Okay, Jethro, that's good. Can you see my questionnaire?
Yes, teacher.
Could you fill it for this class, this practical class, please? Okay, Jethro, that's good, but I will insist. You know the words. You're just forgetting about that. It means that you're not practicing or you're not watching the slides after class or something. Maybe because you have a lot of things to do, but it's better if you practice, okay?
Okay, teacher. That's very complicated, maybe when the words in medicine.
Yes, but most of them, if you can notice, has the same meaning, just change places. Just that, right? It's just you're in your mind, you're in another place. So you have to be focused, okay?
Okay, teacher.
Okay, just one picture. Okay. Okay, Jethro, thank you so much. I don't know if you have any question.
No, teacher.
No, about today's class either?
Yeah, maybe about the talking about the nervous system, right? This word, what is the word?
Or
Losing or
maybe for the next class, Jethro?
okay, okay,
Tomorrow, okay?
teacher. Don't
Okay,
worry.
look for the word and tell me tomorrow, please.
Okay, teacher. Thank you.
Okay, have a good night. Bye-bye, thank you. Hi, Jorge,
Hello,
how are you?
good evening. I'm feeling better, thank you.
Oh, that's good. So, do you have COVID or not?
I don't think so. Actually, I didn't do the test.
Oh,
But as I'm feeling better, I don't think I need it.
okay, I understand. Okay, perfect. Well, do you have the chance to watch the slides I sent to you on the group?
Actually, I didn't. I couldn't
Oh,
because I was taking a test, so I was like short of time.
okay, no worries, but I think you can make it anyways.
Okay.
Think of a patient that may have diabetes, okay? And think about 5 questions you can ask to your patient to go farther or investigate further about this condition.
Perfect.
And that's it.
Okay. First, I would ask him about his or her symptoms. I would ask about if he or she's having an increased amount in time and in how can I say, if he's going or he or she is going to the bathroom like more frequently than before, if he or she is feeling thirsty more than before, also if he or she is feeling hungry. Also, I would ask for familiar history, because it's really important to know if parents, I don't know, uncle, aunt, grandparents had diabetes. There is a lot of inheritance in this case of in this pathology. I would also ask about his or her the smell of his or her breath, the smell of the urine, the pee, let's say. Um, I would think that that would be maybe also how is the physical activity he or she does, how is the how is nutrition going in his or her life.
Mhm.
Yeah, I think that that must be everything.
Okay. And um, is we, I don't know, but maybe diabetes has two types or three,
Yes,
maybe.
two, type 1
Okay.
and type 2. Yeah.
Okay. Can you explain to the
Yes.
patient? Okay.
Okay, type 1 diabetes is based on insulin resistance. It's due to an internal problem of the body, where your pancreas is not working well because the beta cells are resisting to produce insulin, and so that's why sugar cannot get into cells, and that's why it happens. And insulin is not enough, let's say. And type 2 diabetes is more related to obesity,
Mhm.
malnutrition, bad eating habits, bad exercise habits, and it's due to a large history of bad habits, and this is cause of um, malnutrition, as I said, and insulin is also um, below the normal levels, and glucose is over the normal levels.
Okay. Which are the levels? 70.
70 to 110
Okay.
milligrams per deciliter.
Okay. Perfect. And
What?
I don't know, but you will tell me. I've heard about a kind of diabetes that the children, I don't know, maybe they have, but it's another one. Maybe when they born, I don't know.
Okay, maybe the other type of diabetes you're talking as the pregnancy diabetes that also happens,
I
because
think so.
those would be the three types, the basic types of diabetes. And type 1 diabetes is the one that children have, because as it's inherited, it's more most often diagnosed before, let's say, 14 years old. And type 2 diabetes is diagnosed when usually adult people over 40 years old. And pregnancy diabetes is a cause of pregnancy. That is, there is an issue also with beta cells and pancreas, and it is only while the pregnancy is going on, and it's treated sometimes with insulin too. And often it disappears when the baby borns.
Okay, perfect. Thank you, Jorge.
Oh, thank you.
Many patients do not know the function and location of the spleen and the pancreas. How would
Okay.
you explain on easy words to them?
Okay, the pancreas first is one of the most important endocrine organs in the body. It produces, it has three types of cells: beta, alpha, and delta cells. Beta cells are the ones that produce insulin. Delta cells are the ones that produce somatostatin, and alpha cells are the ones that produce glucagon. So they three work in with sugar movement through the body, how it's delivered to the organs, how it how it's like accepted from other cells, muscle, brain, everything. I would say that about a pancreas. About the spleen, you said, right?
Yes.
Okay, the spleen is a lymphatic organ. In this case, it's like a reservoir for for example, it's really important in regarding circulation in the body, because when we were in med school, they used to tell us there was like the graveyard of the red blood cells, and it's related with everything with red blood cells. There are a lot of pathologies that can involve malfunction of the spleen, like sickle cell anemia. That is a kind of anemia where as red blood cells are not well shaped, so they are like catched in the spleen and they're destroyed, and it causes the anemia. Is something it's something related with inheritance too.
Okay. And the location.
Location, okay. For the spleen, it would be like the left side under the ribs, under the floating ribs, on your left side of your. Am I explaining to a patient?
Yes, you're
Okay.
explaining to.
Okay. On your left side of your belly, there is where you feel the hard the hard bones that are called ribs. Under that side is the spleen, and the pancreas is like more located let's say in the middle of your belly, under your intestines, or under your, I don't know, I'm looking for the word, under your
Bowels.
bowels. Yeah, that's what that was what I was looking for.
Okay. Okay, perfect.
Oh, thank you.
Oh, what question I can ask to you? Okay, I know. I want you to choose any other disease,
Okay.
and you, of course, you have to explain to a patient on easy words.
Okay. Let me think. Um.
And asking questions, of course.
Okay. So let's talk about, I don't know, Cushing disease.
Okay.
Okay. So Cushing disease is a kind of um elevation of cortisol level in the bloodstream. Cortisol the has a function to has a lot of functions. For example, blood pressure, weight gain. Um, Also, it's related with sleeping. Is related with glucose levels too. So what I would ask of my patient if he or she have been also taken have been taking some treatment with corticoids, because it's really important. Long treatment with corticoids. Also, I would see the patient faces, because Cushing oil faces is like full moon face. It has like dorsal bump, like the back is like yeah, dorsal bump, I would say. I'm not sure if it's right. Also, I would ask for if he or she had um, gained weight. Also, I would ask about some symptoms regarding edema, for example, because it happens with it causes some renal failure, and it also, the patient also may have water retention. And yeah, I think that that would be enough for glance by a diagnosis. Of course, I would ask for lab tests, cortisol level, glucose level, renal function, and I think, yeah.
Okay, so in this case, you just watching your patient would know if he has this kind of disease.
Yeah, maybe with inspection would be enough. Sometimes, no, not always, but sometimes the patients, medicine is really uncertain. So not always the patient is going to present to your consultation with all the signs and symptoms. But if you're lucky, yeah, that would be like the book cases ones.
Yeah. Okay. So I think I remember that patients may have screwdriver or the shape of a screwdriver on their teeth, maybe. I don't know, but I remember something about that.
Actually, I'm not sure about it. I think that the teeth stuff. I remember something with syphilis, with 30 syphilis, and also in Addison, mucosal hyperpigmentation.
Okay. Okay. Thank you. Thank you, Jorge.
Thank you.
I don't know if you want to add something or if you have any questions of today's class, maybe, or of this class.
Um, I think everything's clear. Well,
Mhm.
actually, I have a general question. I think some of the learning we're getting is like more British, right, than American. Oh,
Yes,
okay,
it's
okay,
more
just
British.
yeah, because sometimes I like I don't feel like with a very let's say familiar with some words or with some terms that are really different with American people. You know, they use a lot of slang and that,
Do
but
you
I understand almost everything.
have you had the chance to read the book I sent you?
No, actually, I didn't. I'm sorry,
Okay,
but I couldn't.
okay, just give it a look, okay,
Okay,
and you will see and you will understand better because this is yes, it's a book from I don't remember the place, but it's Reino Unido,
okay, okay. United
United
Kingdom.
Kingdom. Yeah,
Yeah.
that's right. Okay, sometimes I forgot to.
No, yeah,
Okay,
it's awful. Sometimes you forget words, even
yeah,
though they're the easiest ones, but you forget words. It happens.
right. Okay, so I will send it to you, my questionnaire. I don't know if you can see it. Maybe now.
Oh yes.
Yes, please.
Okay.
For this class, I will take a picture.
Okay, no.
Okay, thank you so much for it.
No, thank
And
you.
of course, tomorrow we have the practical classes at the same time.
No, always time. Okay.
Yes.
Okay, perfect. I have a question too. Maybe on Thursday is gonna be difficult for me. I mean, it's not gonna be impossible, but I might some have some internet connection issues because I'm traveling to a little town, and but I think I will be able. If there is so much trouble with signal, can we reschedule the class, or is it impossible?
Yes, yes, I think we can make it, but it would be I don't know. We will figure it out because
Perfect. It's
oh my,
just an
I think
option.
I think it would be able because I think Thursday is the last class, and then you
Okay.
will have a test
Okay.
on Monday, and
Mhm.
then we will pass to the other course.
Okay,
Okay.
no problem then.
Oh,
I will do all possible things to make a good internet connection. I think we will be able to do it, but I was just wondering what may
okay.
happen if we can't.
Okay.
Okay,
Okay. Thank you so much,
thank
Jorge.
you. Have a
Have a night.
good night. Thank you. Bye.
Bye bye. Hi, Rina.
Hello, teacher.
Hi. Thank you for coming so late.
No problem.
What time is it on your country?
It's a 7:45 p.m.
7:45. Oh, that's good. That's good for you. Well, here is a little bit late.
Uh,
Okay. Okay, Reina. Well, I want you to think about a patient that may have diabetes. Okay? And of course, think 5 questions you can ask to your patient to investigate further about this condition.
okay. The first one probably it's the first is what is your health? What is your health? What is your what is your health like? According to that question, the second one is do you take your medication regularly? Another one is if I don't know what kind of medication the patient has, is what kind of medication do you take, or do you take any medication? The fourth question is about do you have any symptom unusual? For example, tics, loss of conscience, or paresthesia, or tingles. And the last question is about do you have any problem about if you have if you suffer a trauma or herida, I don't know.
Injury.
That is that. Sorry?
Injury.
Injury. My question is, if you have any injury lately, how many time your body takes for a relief
heal.
or to get better? Yes.
Yeah. Or if he has or she has hemorrhage, right?
Yes.
Okay. And if you are suspecting that this patient may have diabetes, what would be the questions for your patient?
Well, the first one is how many weight do you, or the last 4 months or the last 6 months, do you have any gain of the weight unusual? And another is if the patient answer no. My another question is the last 3 months, do you have any loss of weight without any kind of exercise? Another one is about do you have a lot of no, sorry. Do you feel tired lately? Especially after the dinner, the lunch, for example. And another one, do you have problem about your vision? Do you have low vista sight? No. Yeah, sight, vista.
Do you have trouble with your vision? Can you see, I don't know, so far, or you cannot, maybe? Remember that you are asking your patient as is the same in Spanish, right? They don't understand the technical words, so we have to figure it out. Okay, go ahead.
Yeah. I have a question about the weight, the side. Feel tired. This I think that is the same question that the last one, because I had to ask him or ask the patient about do you have tingles in your feet and your legs, or do you have any tics, and do you have any problem about the touch with your hands? Do you have any paresthesias, or do you have a problem when you take or use your hands? For example, write or take something with your hands. Do you have problem with the strong in your hands?
Okay. And of course, remember this specific signs and symptoms of this condition. You can ask to your patient. Okay, go ahead.
I have to ask the patient about the symptoms of the diabetes.
Yes.
Okay. Do you have do you have un aumento, or lately do you have a increase of your desire of drink water, for example? And after that, how many time? How time ago do you have the feeling? The another one is, do you have increase of your appetite? Appetite. And what happens after you eat, you satisfies your appetite? That is another one is about the problem urinate. How many times do you usually go to the bathroom to urinate? And what is the volume approximately that the urine you eliminate? After that, and about the weight.
Do you ask about the smell of the urine, or is it that you just figure it out on the lab results?
Depends what kind of the patient, because that person has in the beginnings of the disease. It's very difficult to the patient told you, yes, the urinate is has a smell sweet. But if in a patient who has a progress advance of the disease, yes, the smell of sweet is very characteristic.
Okay. Understand. Okay.
I think about the 4P or in the disease. So I ask you about the polyuria, polydipsia, polyphagia, and the lost weight.
Yes.
That is the usually. Yeah.
Hey, but that was good. That was really good, actually. And the last question. Well, while I'll send you my questionnaire, you will answer this question, okay? Okay, many patients do not know where are the spleen, or where is the location of the spleen and the pancreas. How would you explain in an easy words to the patient and the function?
About the spleen and pancreas.
pancreas. Yes.
Well, about the, well, in the pancreas, that words that the patient understand. The pancreas is the organ has in the abdominal region. Specifically, if you can touch, it's in the you have to imagine the light center in the abdomen to cross in the sternum or between the
ribs.
The ribs, between the ribs, and you imagine the line across the abdomen in the vertical way. So according with that line, you have to move your hands in the right, in the left side, but not too much. It's between the line, between that part of the abdomen. I have to say that but it's protected about another tissues in the abdomen. So if you put your hands in that area, you didn't feel it. So in some occasion where the organ is increased, but the pancreas, has the form of the leaf. But it's exactly in the position that you imagine your stomach, approximately in the middle of the abdomen, but upper in the area of the abdomen, but a little move in the left. That is pancreas. And another is spleen.
Yes.
Yeah. Spleen is how I tell you, spleen is I'm thinking.
No worries, but in the easiest way as possible.
Yeah. The spleen is the anatomical position. Is in the lower. Is in the legs, but if you think about the lower limbs, that is the area between exactly inter the legs and the beginning of the foot. On the foot is
no.
Yeah. No.
Remember el vaso.
I'm sorry.
No worries. No worries. We usually forgot those terms or words, right?
Yeah.
Oh, Rina, sorry. Can you answer my questionnaire, please?
Okay. I'm finished.
Thank you so much, Rina. It was so good. You gave me a lot of information. And it's just a matter of time that you can practice more to improve your pronunciation. It's just that you have a lot of vocabulary, okay?
Okay, teacher.
Okay, and see you tomorrow at the same time as always, okay?
Okay, teacher.
Okay, thank you so much. Have a great night.
Bye.
Hi. Okay, Ale, good night, good evening.
Good night, teacher.
Hey, Ale. Thank you so much for coming tonight. It will be the last time that we okay, replace our class. Okay, I want you to think about a patient who have diabetes, okay?
Okay.
And you can think about 5 questions that you can ask to your patient to investigate further about this condition.
If the patient has familiarity with diabetes, how much time have diabetes? What kind of diabetes because have two, diabetes 1 or type 1 or diabetes type 2.
Okay.
If it has a complication like retinopathy, or other kind of complication in this moment, because that kind of patient is more difficult to treat, have a good treatment and good life.
Okay. And imagine you're suspecting that your patient has diabetes. What 5 questions you will make to them?
Okay. If has lost weight.
Okay.
Lost weight. Polyuria.
Okay, but remember, I'm your patient. I don't know anything about medicine.
Yes. Sorry. If the patient go to the bathroom a lot of time in a day, okay, I don't remember.
Of course you remember.
Yes, I remember, but I'm nervous always.
No, why? Even me forget about everything, you know?
Yeah,
So,
well, I'm shy and I don't like to speak.
but it will be your job to
Yeah.
speak with.
Yeah, I know.
Yes, you will have to explain to every single patient what is going on, what is happening. So you will have to talk with them.
Yes. But I'm nervous. Okay. If the patient eats a lot, more than normal. If the has a family with diabetes, with that kind of question, maybe clinically we can know if the patient maybe have diabetes. The last question is very, very important because my endocrinology doctor say that the people that don't have this factor don't will be diabetes.
So what was the last question?
If have a familiar or antecedente familiar, I don't know.
Yes. If they have any familiar who has this condition at first,
Yes,
right?
because if you don't have this factor, you can eat a lot of sugar or maybe be sedentary or had weight loss, but you don't will be diabetes. You will be have other problems, but not diabetes.
And what about diabetes type 2? It is not a consequence of a bad diet, sedentarism, and
eat fast food, a lot of sugar, don't do exercise are factors that for start a diabetes type 2, but in person that have a familiarity factor.
Okay, that was good. And I will make you another question. For example, many patients don't know where is the location of the spleen and the pancreas. Okay, so you have to explain to them in easy words, please. And after all, the function of those organs.
Okay, the pancreas and
spleen.
Okay. The both organs are an up left, yes, left quadrant, upper left quadrant. Have different functions. The pancreas produce insulin, hormones.
Okay.
I don't know what's the correct pronunciation of
What was the word?
hormones.
Hormones.
Hormones. Okay, hormones and
Like with
digestive
J. Like with J. Hormones.
hormones.
Yes.
Okay, hormones
And digestive.
and digestive enzymes.
Enzymes.
Enzymes. Okay, have two principal functions, but the splenic have a special function that is a special organ that the erythrocytes will be gonna die. And okay, have a special function for the
Remember that you're
yes,
okay.
my brain is processed medicine, English, and the patient.
Yeah, I know. I understand. Okay, but the basic. Okay, I'm not your doctor, so I'm kind of patient. I won't understand anything else, but okay, in the easiest way. Okay, go ahead.
Okay, have a special function for Z cells blood for the cells of blood. That's all. Maybe for the patient have to understand.
Yes. Okay, that was good. That was good. Another question would be, what are the differences, or could you explain me the differences between diabetes type 1 and diabetes type 2 in the easiest ways as possible?
Okay. In the diabetes type 1, you born with this condition. Okay, your pancreas don't have special cells. These cells produce the insulin, and for that, you can produce insulin. It's a condition that you born with this. In the diabetes type 2, you have a fracture. You can be great all your life if you do exercise, if you eat healthy, but if you don't care you healthy, you eat a lot of fast food, don't do exercise, maybe in this case the insulin is not really efficient or is not enough for efficient. Okay, it's not efficient or it's not enough for what's the word, nivelar, o sea,
I forgot the word. Okay, go ahead. I will.
Okay.
I will tell you.
It's not enough insulin for the sugar in your blood. Okay, and it's for that reason that you will be diabetes type 2.
Okay, so is there any other kind of diabetes?
Yes, we have the diabetes gestacional, gestational diabetes.
Yeah, let me check this out. Okay, but tell me about it.
Okay, in this case, we can have a woman with diabetes type 2, then no what is the correct treatment. The patients know, but in some cases, the the pregnant will be a factor that disencadening of, or the factor that begins the diabetes type 2. In this case, is not the food, is not the exercise, is the state, the pregnancy state that will be a factor that begins. Gestational diabetes.
Gestational diabetes.
Gestational.
Gestational. Yeah.
Gestational. Okay.
Okay, Ale, that was good. And to balance, it might be the word
Yes.
we were looking, because the other thing, it will be unbalanced, right?
Yes.
Okay.
Thank you.
Perfect. So I will send to you my questionnaire for today, for this practice, okay? Please fill it. And maybe, I don't know if you have any questions for this class or any other, you can make it.
No, teacher. It's okay. It's great.
Do you understand?
Yes. Maybe my vocabulary is not enough, but I practice in this. But I understand. But the classes I understand.
Okay, that's perfect. You have, I know you are thinking in your mind, maybe the things, and you're trying to translate. Don't do that. Just think in English. I know it's a little bit hard, but it's with practice. Because when you try to translate, you get some mistakes. Okay? And it's better if you just think in English and talk fluently. I know you can, because I saw it, and then I find out that you have this issue, but it's not bad. It happens to all of us when we are learning English, especially in this class, because we have lots of words, right?
Yes.
Okay.
A lot.
Lots of words, but in generally, it's okay. It's good. Okay, you just need to practice.
Okay. Thank you, teacher.
You speak, you make yourself understand easily. Of course, you have to use most words. Okay, more words, but you can do it. I know you can do it. So prepare for the next level. Okay.
Okay, teacher. Thank you.
Thank you so much. Have a great night, and see you tomorrow at the same time.
Okay, teacher.
Take care. Bye-bye.
Bye-bye. Good night.
You too. Bye-bye. Hi, Carlita. Good evening.
Hi. Good evening.
How are you?
Fine.
I'm fine, thank you. Okay, I think it's not so cold on your country now, right?
Today, no.
Okay, here is a little bit cold.
Yeah.
Well, I want you to think about a patient that may have diabetes. Okay, and you have to confirm. But that's why you will need to think of 5 questions you can ask to your patient, investigating further.
So I just have a suspect that he has diabetes. Okay, I think I will ask if he or she has weight lost. If he is, se me fue la palabra, sediento.
Thirsty.
How?
Thirsty. Thirsty. Yeah.
Okay, thirsty. If he goes to the bathroom more times in a day, if he eats a lot, maybe if he is overweight, and if maybe if he lost the sensibility in their finger, in his fingers, sorry, in his fingers, and
just fingers or toes too?
Toes and fingers.
Okay.
Toes and fingers, and if he can see, or if he needs glasses recently, I think that those are the questions that I will ask at
that
first.
You will ask.
Yes.
Okay. Okay, that's good. I think your patient understand the questions and they will give you the answers. Well, I want to know the differences between diabetes type 1 and diabetes type 2.
Well, diabetes type 1 is in child and in teenagers. So it's a difference, the presentation. So sorry, there's card. So how many years the patient has is really important. And if it's a diabetes type 1, it's usually diagnosed in the childhood or in, how do you say adolescencia? Teen, I don't
know. When the patient was a teenager or in a teenage stage.
Okay, in a teenage stage. And diabetes type 2 can occur when you're an adult person. There's a type of diabetes called MODY, diabetes MODY, that can occur in MODY, MODY, and can occur in persons. Sorry, I moved my car. In persons about the 30s. It's kind of weird, but it's in adult patients, and they will have all those symptoms I just said, like the weight, thirsty, go to the bathroom many times in the day, lose the sensibility, loss of visual, I don't know.
Sight?
Sight.
Loss of sight? Loss of sight.
Okay, loss of sight and
or vision. You can say too.
Vision.
Loss of sight or loss. Yeah.
Loss of vision, and it is I don't know how to say this in English. Está relacionado, vinculado.
It's due like I will write it to you.
Obesity or hypertension or dyslipidemic syndrome and hereditary condition.
Condition, yes. Okay, yes. And I don't know, but I've heard years ago that there is another type of diabetes on newborn, but I don't know. Maybe you can tell.
No, it could be diabetes insipida. I don't know how to say it, insipida in English, but it's a different way of diabetes. It's when you lose, when your body loses the control of the diuresis. Okay. So you lose a lot of water in your body. So you have to take an hormonal treatment. with vasopressina nasal. It's different.
Wow. To lose the whole control of your body, that would be so
Yeah.
bad for patient.
Yes.
Okay. And well, the last question will be, for example, many patients don't know the function and location of the spleen. Do you remember the spleen? Yeah.
Yeah. The
Okay.
spleen
And
is
the
in your hypochondria, ¿cómo dices?
hypochondria. But remember
Hypochondria.
that you're explaining to your patient. The patient doesn't know
Okay.
about those words, those right, those technical
Okay.
words. So you have to explain him or her in the easiest way possible. So the location of the spleen and the pancreas and the function of them.
Okay, so the spleen is located in the upper left side of your abdomen. Abdomen, behind your ribs, and your pancreas is on the right side of your spleen. So your spleen has a function of as a reservoir of the blood, of the red blood cells, and it's the place when the red blood cells are destroyed. And the pancreas has two functions. Produce some hormones like insulin,
yeah,
insulin, and produce some other substance. It's okay. Substances that help to the digestive system.
Okay, the digestive system. It's okay.
Yeah, those are the functions.
Okay, that was good. And the last question, I want you to pick one disease, any disease you want, and explain to your patients, of course, what is this disease, and ask questions about their signs and symptoms.
Okay, I don't know. I think obesity, it could be. It's related with diabetes. Obesity has no, or when what? Almost all the obesity patients know they are obesity when they see in the mirror. But most of the people that have obesity or overweight, they don't assume that they have a problem with their weight. So obesity can cause dyslipidemic syndrome, like a high level of cholesterol or high level of triglycerides. Triglycerides that can cause some heart failure, heart attack, even a stroke, or arteriosclerosis. So
that's good.
So it's a big problem in the public health. So I think that give a control of your weight, may even once in a week, once in a year. It's la mínima cosa. I don't know how to say that in English.
That is the basic thing, or the minimum.
The basic thing you can do with your health, and obviously you have to control what you eat. If you eat always saturated fat. I don't know if it's okay.
Yes, yes.
Saturated fat and fast food, or I don't know,
Junk food.
junk food, and processed food.
Processed food. Yeah.
Processed food. You have more risk of overweight or obesity. And what you can do, you can, well, first of all, have a good nutrition, eat better, take a lot of water, try to evitar. How do you say evitar?
Try to avoid.
Sorry. Try to
no worries.
avoid those food that I just said, and you have to do exercise or some activity that you can lose calories.
Yes, calories.
You can
Yes, that's
lose
good.
calories, and you have to go to your doctor to see these laboratory exams, cholesterol, triglycerides, and even though an echography of your carotid and an electrocardiogram.
Okay, change the lifestyle and diet habits, right?
Diet habits, and go to the doctor, because there are some people that that can have any side, and they can have arteriosclerosis in the carotid, and they could have a heart attack. There's a lot of complications.
Wow.
Yes.
And
you can have diabetes and hypertension and heart failure.
Oh, everything. So how much weight do you have to know that you are obese?
You could have this how do you say indice? There's a corporal
the level, the indicators. Indicators.
Yeah, there's a there's some indicators with a formula that it's your weight in kilos, divided for your height in meters. ¿Cómo digo? Al cuadrado.
Wait.
Nunca he dicho eso en inglés. But you have this indicator. So when you are behind 18, you are you're a teen person. If you're from 18 to 24, you have a normal. If you're over 25, you have overweight. And if you're over 30, you have obesity.
Okay, square. Cuadrado.
Square.
Yes.
Okay.
It happens all the time to all of us, so don't worry. So, but you have to be focused, and maybe that will work. Okay. Sometimes we are thinking about another things. That's why we made some mistakes and maybe forget about everything. It happens to me. I know it happens to you. Okay. So thank you so much for coming tonight, and see you tomorrow at the same time as always. Okay.
I have a question. Wednesday we have classes.
Yes, we have classes.
I have en español, tengo un evento acá de la diabetes que tenemos que lanzar a la ciudad, y es a las 6:30 y no creo que me pueda conectar. Entonces,
lo vamos a poner. Te pongo licencia. No creo que podamos reponer, pero puedes ver el video de la clase. Y así practicas para la clase práctica del día siguiente, ¿ok?
Exacto. Ya, está bien. Muchísimas
Ok,
gracias.
no te preocupes, pero hazme recuerdo, por favor. Ya sabes que
Te
todo el
mando un
mundo.
mensaje. Sí, sí, yo sé. Ya,
Vale.
muchísimas gracias. Nos vemos mañana. See you
Have a
tomorrow.
great night. Bye bye. Okay, Carlita Barta, thank you so much for waiting. Can you turn on your camera?
Okay. Oh,
Okay. Thank you so much for waiting. And let's start then. What time is it on your country? Or you're in Bolivia?
10:32 in Bolivia.
Ah, okay. We are at the same time.
Yeah.
I will let you sleep. Just this. Think about a patient that
Okay.
have diabetes, okay? And you can ask 5 questions to investigate further about this condition. Maybe you're suspecting that this patient has diabetes.
Okay. If I were suspecting if the patient have diabetes, is that correct?
Diabetes.
For diabetes. Okay. I will ask first. I will ask which is the reason for her or his visit, and after that, I will see the age of the patient, if he or she is fat, first of that, and when I would ask them if do you usually feel thirsty? Could be. Another thing will be how often do you go to the bathroom to urinate? Will be
To urinate.
How often do you urinate? Okay, thank you.
No worries. I'm here. I'm listening. Okay, so tell me. I'm just gonna turn off my camera. Just a second.
How is your daily diet? How often do you exercise? If she or he has family with diabetes, and another, she feel, do you feel hungry? Will be hungrier than before that? I think that.
Okay, that's good. Yes, that's good. And maybe could you explain to me the differences between diabetes type 1 and diabetes type 2?
Okay, diabetes type 1 is most common in I forget how to say joven.
Teenager?
Teenager
Or
people.
young.
That's
Young
correct.
people.
The young people. It is a genetic problem. It when there isn't enough insulin, so we have to inject insulin to because insulin is a hormone that is like a open door, puerta de entrada. How can I say that?
Yes, it can be an open door.
Okay, it can be an open door for the glucose, that is the azúcar en la sangre, sería
Sugar.
Sugar
On blood.
On blood.
Into the blood.
Sugar
Into the blood.
Okay, sugar into the blood. So if there isn't enough insulin, sugar would increase in the blood, and this is the
Increase.
increase. Oh, yes. That's correct.
Yeah. Yes, that's correct.
Okay. This is diabetic type 1 and diabetic type 2 would have risk factors like genetic problems, but it's more the principal reason is bad habits like don't exercise, eat badly, eat bad,
Evade,
excuse me?
evade, avoid,
Eat bad.
eat bad.
Okay. Okay, a lot of sugar, carbohydrates.
Carbohydrates.
Yes, and bad lifestyle is that the principal reason. So it is more common in people, old people, and fat people. I think those in this case there are hormone
Insulin, hormone. Yeah, insulin.
Okay, but there isn't function well. I think there it isn't function well. Is that correct? ¿No está funcionando bien?
Yeah, that's
yes.
good.
Yes. So the tratamiento,
the treatment
is different. It's different, but both can complicate it. Be complicated. Yes. Yes, I think that.
Okay, that's good. I don't know if you remember another kind of diabetes, because I've heard a lot of years ago, and I don't know if it's still.
Yes. Yes, but there are actualization every year, and it has some change. Another it will be
Pages.
diabetes. Yes, LADA, but I don't remember well this type of diabetic. It's like LADA. Yes, del adulto mayor, algo así. It's like the diabetic type 1, but in all people. So there isn't a reason, a specific reason. Another will be
So you tell me.
pregnant.
Yes.
Yes.
Yes, yes, go ahead.
Another diabetic in woman pregnant. Is a complication of that. Another, I don't know. I don't remember.
Okay, but just to mention,
yes.
it is good. It is good, just to mention. Okay, I just wanted to know. Thank you so much. Another thing I want you to tell me is, please, as you know, many patients do not know the function and the location of pancreas and diabetes. So I want you to explain to a patient in easy words, where is the location and the function of those organs.
Yeah. Okay. Pancreas is a glandular organ.
Yeah.
That is ubicated in abdomen. Yes. Ubicated?
Located.
Okay. Located, sorry. It is, how can I say rodeado? Rodeado.
Rounded.
Okay, it's stomach, bowels.
Rounded by
bowels and other organs. It is essential. Rounded by
Or
this is important to the digestion. Excuse me.
surrounded.
Surrounded.
Even me is forgetting some words. So surrounded by.
Surrounded. This is the envuelve or rodea.
Yes. You can also say involved by, but it depends on the word you wanna use. Okay.
Okay. Thank you. Yes. The function of pancreas is important in digestion of food, and also it makes or does some important hormones like insulin, and that it's important to diabetic. I think that.
Yes, that's a good explanation. And the spleen
is spleen? Is that
yes.
vessel? I'm not sure.
Yes.
Okay. Okay.
Good.
It's an organ on the left side of the abdomen, and it is a lymphatic organ, will be.
Yeah.
Above over the stomach, and will be
stomach.
Stomach?
Yes, Carlita, stomach. Remember, headache, stomach ache, stomach. Okay.
Okay. Stomach. Okay. And below the ribs, it is important to defensa del cuerpo.
It's important to defend the body.
Yes, and it's more important in the first months when we are babies, I think.
Okay.
I don't know how to explain more.
Okay, that's good. Okay, Carlita, could you please fill my questionnaire? I will take a picture. And remember, tomorrow we have the practice class of today's topics.
Tomorrow? Practice?
Yes.
Okay, yes.
At the same time as always, okay?
Yes, I think I am 7:15. I'm not sure.
You have to watch it on the group, okay, please?
Okay. Thank you.
Thank you. And thank you for coming so late. So I will let you sleep now. But just one picture more. And then I will let you go. Okay.
Okay.
Thank you so much. Have a great night and see you tomorrow.
You too.
Okay?
Bye. Okay, see you tomorrow.
Bye-bye. Take care.